I was teaching school when I met Howdy. When he went to the Star Democrat, which is the job he took down here back to journalism, Gail Romaine was the wife of the editor at that time, and she was the French teacher at the country school. And there was an opening for a third grade teacher. So we moved here in January of 76 it was. And by the next fall, I was teaching third grade at the country school. So I immediately had exposure to meeting all of these families. When we moved here in 76, there was a lot of successful retail downtown. Nevia's hardware store was still downtown. We had Rowan's, but there was a wonderful shop, Sports and Specialty, which had really wonderful sportswear. And I walked in there not terribly long after we'd moved here, and I'm trying on a pair of corduroy pants, and I can't decide. And the woman turns to me and she says, "Would you like to take those home on approval?" And I said, well, yes. And she put out this pad of paper and she took my name down and she said, "If you want to keep them, just give us a call. Otherwise, just bring them back." I mean, I think that sums up the way it has been for us. And of course, I can't imagine living anywhere else that I would have been, we as a family, I would have been happier to be. Hospice really began in England, and it was an old concept of travelers on the road and being able to stay at hospice, and of course the word hospitality is related to it. But in the 1960s was when it really became known as an opportunity to discuss, as you're suggesting, how people would want to die. And having some opportunity to be part of that decision. Otherwise, you basically died in the hospital. It was an institutionalized death. And part of hospice was the concept of palliative care, which was symptom management rather than curative, rather than doctors working to the last minute to reverse in some way your physical condition. And so a conversation started about people wanting to choose, people wanting to be at home as a home care, dying at home. And I think it was really, so the first hospice opened in New England in 1970. And our hospice opened, the first year was 1981, and Dr. Guthrie was the health officer at the health department then. And he had learned about that. He, along with Kathy Foster, who was, I don't know if she was head of nursing then, but she was a very prominent figure in terms of nursing services. And she ran the home care agency, which hospice was then built onto. So brilliantly, hospice became added on volunteers, other components such as spirituality with a chaplain and a social worker and so on, to have a real holistic opportunity for people and families to think about what dying meant to them, in addition to the physical failure of it. So when I came aboard, the Hospice Foundation sat in a 10 by 10 cubicle in the health department. There were 3 of us, Melly, we had a secretary, and I think I had a student desk. So to put this together, and this is true of many of the counties on the Eastern Shore, how it got started. The health department said, we want to provide end-of-life care. We've got the home care medical piece. We need to have volunteers. We need to have the spiritual components and so on. And but you had to fund yourself for these components of it. So that's why it became the fundraising aspect, because home health was getting Medicare reimbursement. And then in 1983, I think I've never been aware of government inspiration that quite equals Medicare hospice benefit. So in 1983, the Medicare hospice benefit got added onto traditional Medicare for home care hospital. And in their brilliance, Medicare mandated that an amount of hours annually had to be contributed by volunteers equal to 5% of the time the paid staff put in. So think about the federal government instituting this stream of reimbursement that mandated volunteers. I don't think there's been anything like it. 2004, I'd been at hospice for 14 years, and I have found about myself that I like to build things. And it was time for new leadership, new eyes on the hospice program. And so I did a little consulting. And then one day, my phone rang, and Mike Roman, who is the director of Horn Point Laboratory, called me up and said, I'm looking for a development person. We haven't had anybody for 10 years, and Tom Hill said I should call you. So I met with him at the News Center Cafe, and we chatted. And as he described what he wanted, it sounded like an exciting venture. And I said to him, you know, Mike, I'm really perfect for you to translate what the library does for the community, because I was a failure at math and science my entire academic career. So if I can understand it, I can talk about it, then other people, I'll have the pleasure of helping other people to understand what a science institution does. It was I was there for 10 more years. I was never thought that this would be the case. I really became quite enchanted with learning about the Bay. It was going back to school again. And you know, there are a lot of lifelong learners in this community. So I think that's one of the reasons that people began to be fascinated about Horn Point and what it does. I think it has to do with the fact that I fell in love with the students, the graduate students. And you know, science for graduate studies does provide a stipend, but oh my God, they lived on a pittance. And if it was a PhD, it was 5 years. Talk about commitment. So I think part of that was my education beginnings, getting to know these young students, and so how we use them as the vehicle to tell the story. And then, so I said, okay, we've got to have an event, because we were doing this in people's homes. It was well received. And so I said, Mike and I said, what are we going to call it? And I said, well, we're going to go big or go home. I said, you know, we're not going to name it Horn Point something else. We're going to call it Chesapeake Champion. You know, fundraising, for those of us who do it, we would never ask for money for ourselves, but when you feel so strongly about something, these young people, really the money we were raising was to support graduate education. So we had the event, and people got really excited about it, and we started an endowment for graduate education. And when I left, also half of which came from a wonderful legacy from a woman who became a really interested person, we had $1 million endowment for graduate education. So many people move closer to children. But as I told you, if our brains weren't so engaged in this moment and we're moving at the end of the month, I mean, we could sit around and be puddles of tears because of the leaving. Yeah. As I said, it is a death of sorts of a life that we have enjoyed and loved more than anything. But we will have life and we will see our friends, and it'll be different, but I have to believe that, and we've been most fortunate in our lives, and I believe that somehow with making a plan and going forward and being able to watch the little grandchildren more closely grow up, there will be plenty of fine times ahead of us.